anyone who suffers with sickle cell and the complexities that it has on our bodies, you'll know of the challenges of what it is to live with sickle cell. So please give them a round of applause, and thank you very much.
So good afternoon everyone, hello, good afternoon. I think the first thing I want to say is a big thanks to the Watford African Caribbean Association for inviting me. There are many people in this room that I know, and many people who have supported the work of the Sickle Cell Society over many years. So thank you for that. Now, I'm just going to build on some of the things that Dr. Charles talked about the red blood cells, because at the end of the day, sickle cell is a red blood cell condition, so it affects the red blood cells. And as Dr. Charles said, what the red blood cell does, it's round, it's very supple, and what it does is carry oxygen all over the body, including to your brain. With sickle cell, the name is exactly that. It's a banana shape and a sickle shape. And therefore that red blood cell is sticky and it gets stuck in the blood vessels. And when you have sickle cell, wherever that sickle cell gets stuck, it could be in your back, it could be in your arm, it could be in any part of the body, there is no oxygen going to that part of the body, and that causes extreme and excruciating pain. And that pain is so bad most of the time that you end up in accident and emergency. It's not pain that you say, well, I'm just going to lie down and take a paracetamol. When you go to accident and emergency, the pain relief for sickle cell is morphine, ketamine, and controlled drugs that you can't get over the counter. So that's what it is. Let me tell you now, looking at this room today, I can tell you now that at least a third of people in this room will be healthy carriers of the sickle cell gene. So those are individuals who have the gene, the sickle gene, but they're perfectly healthy, in contrast to those who have sickle cell anemia, which is where the red blood cells get stuck in the body. And let me just give you an example. So when you talk about sickle cell, sickle isn't just about pain, it isn't just about the pain. And the pain is unpredictable, it can come at any time. It's not like it'll come at 6 o'clock on Friday, it will come at any time. It's completely unpredictable, and I can give you some of the triggers for the pain. But sickle is the most, it's a multi-organ condition. So alongside the pain, you have organ damage over the years. So it's not unusual for a young person with sickle cell who might be in their 30s to have a hip replacement because of necrosis of the hip. And there's something called vaso-occlusive crisis, which is like a heart attack. So it's really multi-organ, it affects all of the organs. And this is fact. A child, by the time they are 12 years old, will have had 2 silent strokes caused by sickle cell. Stroke is a huge complication for children and adults. And the other important thing for you to know is that there are 300 babies born with sickle cell every year in this country. It's the biggest genetic blood condition in the world. Let's take West Africa, the Caribbean. These are places where there are lots and lots of people who are healthy carriers. And 2 healthy carriers have a 1 in 4 chance of having a child with sickle cell anemia for every pregnancy. So you could have 4 pregnancies, and each pregnancy it's a 1 in 4 chance. So you might have 4 children, 3 might be healthy carriers, and 1 might have sickle cell anemia, but it could be any combination. And the really important thing, and this is linked to the work that we do, so thank you Rachel and all my staff, but sickle cell is the biggest genetic blood condition in the UK, in the world, but it is the least well funded compared to other conditions. So if you take cystic fibrosis, lots of funding for cystic fibrosis, for haemophilia, these are comparable conditions, but sickle cell is the least funded. And in terms of who it affects mainly people whose ancestry or heritage is from Africa or the Caribbean. But let me also tell you that in global terms, India has lots of sickle, Saudi Arabia has lots of sickle, Europe, France, Holland, Germany, all these places have sickle. And I'm going to give you a fact now, which somebody questioned and said, Mr. James, where's your evidence for saying that? So 1 in every 300,000 white, so this is white Caucasian children born in the UK today, is a white child who has sickle cell anemia or is a carrier of sickle cell. And somebody said to me once, Mr. James, we're all doctors and nurses here. This was a talk I was giving to doctors and nurses. Where's your evidence for saying white people get sickle cell? So the simple answer is the Sickle Cell Society campaigned to have a newborn screening program in this country in the 80s. And so there's a newborn screening program in this country, and every child born, that's why I can tell you there are 300 plus babies born each year. We know the ethnicity, and that's why I want to make that point, because lots of people think, oh, it's only black people who get sickle cell. That's not true. Cyprus, Greece, Turkey, all these places have sickle cell. So when you think of sickle cell, remember it's predominantly affecting our community, but there's so many mixed relationships. It's truly a global condition. So I just wanted to share that with you. Thank WACA for all their support and help over the many, many years, and hope what I've just shared with you gives you more information and education about sickle cell, and want you to just have a good and informative afternoon. So thank you for listening to me. I'm happy to answer any questions in the time that I have. So if you have any questions, feel free to ask me. And I can see a hand up. That was you were quick. That came up very quickly. So thank you very much. Let's take that question.
Thank you so much for such an informative talk.
My pleasure.
Hugely ignorant about it, so thank you for raising my awareness, and your colleague on the stall is fabulous too. My quick question: I work for a charity about, one of the things we do is raising awareness of cancer in underserved communities, which includes the black community. So can you tell me, is there a link? If you have sickle cell, are you more prone to cancer or more likely to have mortality from cancer? Is there any link?
That's a really good question. So living with sickle cell, and because I said it's a multi-organ condition, there are many complications. Of course you can get cancer with sickle, but it's not as a consequence of having sickle. You'll get cancer, but the really important point about sickle is that your life expectancy is 20 years less than somebody who doesn't have sickle. The really important thing is to say that people living with sickle are living longer in the UK than other parts of the world, but there is still a 20-year gap. And just to say that not everybody dies in their 40s and 50s and 60s, because I was at a birthday celebration of a 90-year-old woman with sickle cell a few weeks ago. So I hope that answers your question. Yes? Okay. Go ahead.
So I'm born. At what age will my parents know that I've got sickle cell?
Ask me the... Yeah.
At what age would my parents know that I've got sickle cell?
Let me answer that in two ways. So we have a screening program in this country, and not all countries have a screening program. So at the point that a couple are expecting a child, they would be tested and given choices. So father would be tested, mother would be tested, and information would be given that you're both carriers, or one's a carrier and the other one's not a carrier. And so that's the point in this country. So, but if you look at some parts of the United States, some parts of Africa, the Caribbean, there's not a screening program. Let me give you a true example. I'll be very quick about this. Somebody contacted our helpline. This was about 5 years ago. We were so busy, the call came through to me. And it was a man in his 40s, very fit, and he had to go to hospital to have a sports injury. And after the sports injury, the consultant said to him, "Mr. So-and-so, you'll be fine. You can go back and play whatever sport he used to play. But by the way, I didn't know you had sickle cell." And the man didn't know he had sickle. He was a carrier. He didn't have sickle cell anemia. He was a carrier. And he contacted our office and said, "Listen, there's nothing wrong with me. My consultant, I didn't want to have this conversation with my consultant because I don't know what he's talking about." And we explained, "You're a carrier. That's what he's referring to." And really, he said nobody in the family had ever mentioned that there was sickle cell in the family. The quickest way to find out if you've got sickle cell is to ask your GP. Dr. Giles will tell you that. Ask your GP for a blood test. So you can be a healthy carrier and won't have the sickle cell anemia, but if you have sickle cell, you'll know as a child if you have sickle cell, because if you're a mother or a father, you'll be taking them to hospital, and how they thrive will be slower than children who just have the rambling cells. Does that answer your question? Great. Yes.
And just before you wrap up, I know that a lot of doctors in A&E, when someone in crisis arrives and they don't take that individual seriously, that A, that they've got sickle cell, or B, that the pain is excruciating. And I've heard of a number of individuals who have been in crisis, who've discharged themselves because it is thought by the doctor on duty that they are over-egging their symptoms. What work is being done there?
That's a really important question. And linked to work that we've done called No One's Listening. We produced a report called No One's Listening because those A&E doctors weren't listening. Let me tell you now that if you have sickle cell and you go to hospital with your crisis regularly, you are accused of being a drug seeker. You're not really in pain. You're here because you want another shot of ketamine or morphine or whatever it might be. So male and female people are, characterised as drug seeking. So we produced a report about 3 years ago which went to Parliament, and as a consequence of that report, there has been more investment by the NHS in training A&E doctors, because I can tell you now, whether you live in London, Manchester, Liverpool, Bristol, Birmingham, wherever you live, the experience of people who live with sickle cell going to A&E is absolutely appalling. So the good news is, from No One's Listening, there has been investment to train A&E doctors, and the reason they train A&E doctors is that most of them are junior doctors apart from the consultant, and they keep rotating fairly regularly. So there has been investment to get more knowledge and education of A&E doctors, and there's something, if you're at Watford General, look out for something called Can You Tell It's Sickle Cell, or the Act Now programme, which are all things to elevate the awareness of doctors and nurses about treating patients in A&E. Final thing to say about it, because it's really important. For many years, and this tells you how serious it is, for many years there's been a national guideline by the National Institute of Clinical Excellence, NICE, that if you are in A&E with a sickle crisis, you should get pain relief within 30 minutes of that attendance. Now, I can tell you 80% of A&E departments are nowhere near providing that, and that's another factor. And when we challenged them about that, the answer is, oh, well, A&Es are so busy. But this standard has been there, and the reason for that is if you don't treat sickle well, you can deteriorate, and it can lead to death, sadly. So I hope that answers a detailed answer, but thank you.
And I've seen it, and I've witnessed it, and I have witnessed it at first hand, the appalling treatment of individuals who have been accused of being drug peddlers when I can see they're in genuine crisis. So it really has distressed me somewhat. But thank you very much. So thank you for coming along and telling us a little bit more. Let's give them a round of applause. Thank you.